Hi, my name is Lynn, and I'm from Skillman, New Jersey. A few years ago, I started having some issues with acid reflux. I've always heard great things about Penn Medicine Princeton Medical Center. I do receive monthly emails from the hospital about their programs that are available. So there was one being offered about a year ago with Dr. Sheth, and I thought, well, that's interesting because I had some gastro issues and I wanted to hear what he said.
My specialty is gastroenterology, so I take care of a wide variety of digestive health issues, anything from individuals who are having trouble swallowing to acid reflux issues, abdominal pain, and a lot of what I do involves doing endoscopic procedures. The two most common procedures that I do are upper endoscopies, which involves looking at the esophagus and the stomach, and then colonoscopies, which we do primarily for colon cancer screening.
Actually, my provider, when I went for my routine physical, he said, it's really been a number of years since you've had a colonoscopy, and because you had polyps, I really think that this is something you should do and check with your gastro, in his opinion. So a couple months later, I reached out to his office and made an appointment to see if I could talk to him about my gastro issues.
I remember Lynn very well. She came to me with her own set of gastrointestinal issues that we discussed in the office really over the course of a couple of visits, before we decided to do some further investigation.
He really took time to listen to me and my concerns. And to me, that's very important for a physician to really listen to you and for the patient not to feel that they're being rushed or hurried off.
Basically, the procedure itself is about 15 to 20 minutes. We do give patients sedation, which is sort of a moderate sedation. It's not general anesthesia, but they're basically taking a nap, very comfortable. And really the main objective for a gastroenterologist is to take their time to look carefully at the entire colon, to look for precancerous polyps, which are called adenomas. So by finding these polyps and removing them during the colonoscopy, we can prevent colorectal cancer from forming 7 to 10 years down the road. It's really important that the preparation works and is done effectively, because that maximizes the chances that your gastroenterologist will be able to see things clearly and find polyps. Remember, polyps are sometimes small, sometimes very flat.
I knew that typically when you come out of it, there is no pain or discomfort.
Having gone through this myself, I can tell you I had absolutely zero discomfort.
And they just reassured me that they're there if I needed support when I came home, to reach out to them and be in touch. I did receive a follow-up phone call the next day, which I really appreciated. I even got a thank you note from the nursing staff, which I really appreciated.
In Lynn's case, she had 2 precancerous polyps. Both were small in size, so her follow-up colonoscopy will be in 5 years, and that's to look for potentially other polyps that have grown in the last 5 years.
And then after the biopsy was completed, I did receive a message from Dr. Sheth saying that everything was great and to follow up in another 5 years. I didn't have any side effects from the surgery. I didn't have any discomfort. It was simple.
And so if you haven't been through a procedure like this, there's definitely a lot of anxiety about it. But having gone through it myself and having seen thousands of people through the procedure, I tell patients who are anxious, I have never had a patient in the recovery room tell me that the procedure was worse than they imagined. And in fact, people who have delayed the colonoscopy will say, look, if I knew that that's all that this was, I would have done this, 5 years ago or 7 years ago.